So this HESI review will include questions from every chapter. And basically, as we go through it, if you are unfamiliar with a question or not very strong on the answer, then that's a really good indicator of where you can focus your studies before the HESI. Um, Also, if you are flying through some of these questions, concept related, then that can also aid you in where to focus your studies so that you don't get too overwhelmed studying a bunch of stuff because some things you may, be very well versed in and you won't need to spend too much time on it. Okay. All right. So I'm going to share my screen here and we will get started. Okay. So like I said, this is just a PowerPoint of questions. Since it's just you, if you don't know the answer, it's fine. We're going to go through all of them, questions and answers. So just try to answer if you know it, and if not, we'll talk about it. Okay?
Okay.
Alrighty. First question. Which statement made by a patient demonstrates a healthy degree of resilience? This is a select all that apply. So remember, when we're taking exams, we want to really analyze what the question is asking, looking for keywords, looking for knots or does not include, select all that apply, um, which of the following is incorrect. You may see things like which of the following requires intervention or which of the following requires further teaching. You can think of that synonymously with like which of the following is the wrong answer or is not correct. Okay, so in this case, we're looking for a select all that apply, and we're looking for statements that demonstrate resilience. So A, I try to remember not to take other people's bad moods personally. B, I know that if I get really mad, I'll end up being depressed. C, I really feel that sometimes bad things are meant to happen. D, I've learned to calm down before trying to defend my opinions. And E, I know that discussing issues with my boss would help me get my point across.
Um, A, D, and E.
Perfect. That's right. A, D, and E all demonstrate healthy resilience. Good job. A male patient reports to the nurse, I'm told I have memories of childhood abuse stored in my unconscious mind. I want to work on this. Based on this statement, what information should the nurse provide the patient? To seek the help of a trained therapist to help uncover and deal with the trauma associated with those memories, how to use a defense mechanism such as suppression so that the memories will be less threatening. Psychodynamic therapy will allow the surfacing of those unconscious memories to occur in just a few sessions. Group sessions are valuable to identify underlying themes of the memories being suppressed. So, which of these statements is the most accurate and the most correct to tell a patient?
I'm not sure, but I'm gonna go with A.
That's correct. It is A. Good job. So, we want to encourage our patients to get the help that they need. And in this case, we're telling them that they can get help from a trained therapist to help them uncover the trauma so that they can deal with it. When considering the suggestions of Hildegard Heplau, which activity should the nurse regularly engage in to ensure that the patient stays the focus of all therapeutic conversations? Assessing the patient for unexpressed concerns and fears, evaluating the possible need for additional training and education, reflecting on personal behaviors and personal needs, or avoiding power struggles with the manipulative patient.
C.
That's right. See, so the question is asking, what can the nurse do to ensure that the patient is always the focus? So, if we evaluate ourselves, if we reflect on our own behaviors and our own needs, that will keep us from putting those behaviors and needs before the patient. So, very great. That was good. In an outpatient psychiatric clinic, a nurse notices that a newly admitted young male patient smiles when he sees her. One day, the young man tells the nurse, "You are pretty like my mother." The nurse recognizes that the male is exhibiting A, transference, B, ID expression, C, countertransference, or D, a cognitive distortion.
A.
That's right, A, transference. So remember, when a patient treats a healthcare member a certain way based on a family member or a friend or previous experiences, that's called transference. When a healthcare provider does that same thing to a patient, it's called countertransference. Which antidepressant is contraindicated in a patient diagnosed with a seizure disorder? Bupropion, mirtazapine, paroxetine, or venlafaxine?
I'm not sure. A.
That's right, it is A. So remember that Wellbutrin or bupropion actually lowers the seizure threshold. So it's contraindicated in patients who have seizure disorder. It's also contraindicated in patients with eating disorders like bulimia or anorexia because because of the possibility of them having seizures, we should not give them bupropion as a method of treatment. Specifically with bulimia, we talked about how with the vomiting and the electrolyte imbalances, they can develop seizures. So we want to avoid Wellbutrin or bupropion. Very good. Which antidepressant requires special dietary restrictions to prevent the possible development of hypertensive crisis? Amitriptyline, duloxetine, escitalopram, or phenelzine?
Um, Amitriptyline.
Okay. So which class of antidepressants requires you to implement dietary restrictions? Do you remember?
The MAOIs.
That's right. And do you remember what that dietary restriction is?
Tyramine free.
Right. So amitriptyline is a TCA, duloxetine and escitalopram are SSRI, SNRI. So the last one is phenelzine D, which is an MAOI. Okay. Okay. Which second generation antipsychotic requires routine absolute neutrophil count monitoring? Brexpiprazole, clozapine, risperidone, ziprasidone.
Clozapine.
That's right, clozapine. Very good. Okay, we're moving past drugs for a little bit. You did great though.
Thank you.
The mental health team is determining treatment options for a male patient who is experiencing psychotic symptoms. Which questions should the team answer to determine whether a community outpatient or inpatient setting is most appropriate? This is a select all that apply. Is the patient expressing suicidal thoughts? Does the patient have intact judgment and insight into his situation? Does the patient have experiences with either community or inpatient mental health care facilities? Does the patient require a therapeutic environment to support the management of psychotic symptoms? Does the patient require the regular involvement of their family, significant other in planning and executing the plan of care? So, which of these statements do you think is pertinent to make the decision as to whether a patient should go outpatient or inpatient?
Um, A.
Definitely A. Mhm.
C.
Mm. Okay. Any others?
Um, D.
Okay, just those ones.
Hmm.
Okay, so definitely A, right? That's one of the biggest determining factors if somebody should go inpatient. Are they suicidal? Are they a harm to themselves or to someone else? So definitely A. B talks about whether the patient has judgment and insight. So if a patient is lacking judgment and lacking insight, then they may be posing a safety risk to themselves or others, right? Because they're not able to make good calls, if you will. So definitely B. With C, wondering if a patient has any experience with community or inpatient, while that is something that's good to know, it's not going to make a difference when we are deciding if they're going to go outpatient or inpatient. For example, if a patient is suicidal, it does not matter if they've been successful or not in community because they have to go inpatient for safety reasons. So C is not one of the answer choices here.
Okay.
Now, with D, does the patient require a therapeutic environment to support the management of psychotic symptoms? That's a really good thing to consider, right? Because if they require their environment to be controlled so that they can have help managing their symptoms, it's more than likely going to be that they should go inpatient as opposed to a community outpatient program. Because remember, with outpatient programs, they're not going to be there 24/7. So if they are to go home but still need that therapeutic environment, then they're going to be out of control. And then finally, E, does the patient require the regular involvement of their family, significant other in planning and executing the plan of care? This is important because if a patient always needs someone to be involved in their care, then community outpatient may not be the best option for them because there isn't always going to be somebody there to help. Um, and if they need someone to help make decisions for them or with them, then we can go back to, does the patient have intact judgment and insight? Is the patient able to make decisions for themselves? In those cases, they should be inpatient. Okay, so the correct answers are A, B, D, and E.
Okay.
Great job. Okay. An adolescent female is readmitted for inpatient care after a suicide attempt. What is the most important nursing intervention to accomplish upon admission? Allow the patient to return to her previous room so she'll feel safe. Orient the patient to the unit and introduce her to patients and staff. Build trust through therapeutic communication or check her belongings for dangerous items. What is your first intervention?
I think you'd want to check for dangerous items, make sure
Absolutely.
that they don't have anything on them.
Absolutely. Very good. You want to do that before you do anything else because she is there after a suicide attempt. So we have to keep her safe. And if we don't check her belongings first before we orient her, before we introduce her to people, before we create a therapeutic communication or a trust through therapeutic communication, she could have means to harm herself that we did not make a priority. So remember, we've talked about this before. It's always safety first. Very good. Which nursing intervention can help a Hindu patient to maintain his religious practice? Help the patient to choose his own food from the menu, contact the hospital pastor for a visit, show him which side of the room faces east, or offer him a Torah.
Um, well, it says religious practice, so I don't think it would be A.
Okay.
Um, I'm gonna say C.
Okay. So with these answer choices, I can see where the confusion is. Well, it's religious, so it must be something that's rightly religious or overtly religious. But remember, certain religions have specific dietary restrictions that are based on their religion. So, for example, Muslims don't eat pork. That's a religious dietary restriction. Um, uh, the Jewish faith don't eat pork. They also typically don't eat shellfish. With Hinduism, they typically don't eat beef. So definitely helping them choose food would be a religious practice. When it says contact the hospital pastor, pastors we usually associate with Christianity or Catholic, no, not Catholicism, Christianity, right?
Mhm.
So we can already say it's not that. Showing him which side of the room faces east, that's important for prayer and that's important for the Muslim religion because they face east when they pray. Offering him a Torah, that is the religious book or Bible, if you will, for Judaism. So those three don't apply anyway. It would be A.
Okay.
So something that's can be helpful, and it's another test taking strategy. When you read a question, if you aren't um, like quickly thinking of things related to it, like if you're looking at the question, you're like, I'm not really sure. The next step could be to look at each answer choice and see which of the answer choices you can eliminate right off the bat, because of other knowledge that you have. And that might help you even get down to a 50-50. Implied consent occurs when no verbal or written agreement takes place prior to a caregiver delivering treatment. Which of the following examples represents implied consent? The mother of an unconscious patient saying okay to surgery, care given to a heroin overdose victim, immobilizing a patient who has refused to take medication, signing general intake paperwork with specific parameters.
I'm not sure. A.
Okay, so with implied consent, we are talking about basically we can imply, we can assume that we have consent to do something. So the first one, A, the mother of an unconscious patient saying okay to surgery, we don't know how old that patient is. That patient could be an adult, and we can't take the mother's okay from them because to do a surgery because it's ultimately going to be up to the patient. Secondly, with this answer choice, there's nothing in it that says it's an emergency. So we would want to avoid that one. With C, immobilizing a patient who's refused to take medication. Remember, if you immobilize a patient, that is a form of restraint. And remember, restraining is always the last intervention we use with a patient. So, with a patient refusing to take medication, again, we don't want to add information that's not there. Maybe the medication isn't required. Maybe the patient has the ability to make decisions for themselves and they are refusing, like that's their right. So we can eliminate C. Signing general intake paperwork with specific parameters. So when we are talking about signing paperwork, it's important, especially it notates that there's specific parameters. It's important to remember that patients, whenever they sign anything, have the right to be um, educated on whatever it is that they're signing, even if it's just normal general intake paperwork. Okay. So that leaves B. The patient we're talking about is in an emergent situation. They are currently overdosing on heroin. If we do not intervene, they will die. So that is one of those situations where we can assume we can administer care to this person because there is nobody there, including the patient, telling us that they don't want to be saved, if that makes sense.
Okay.
Okay. So that would be the correct answer here, B. Now, the other thing to keep in mind too, let's say you are to administer the reversal agent to this patient and they come to and they're mad because they wanted to die and you wouldn't let them. You are protected under the Good Samaritan Act in that case because you are acting on behalf of they were probably brought in by EMS, or, you had the Narcan and you saw them overdosing on the street. So you would be protected in that sense because of the Good Samaritan Act. And that also applies if, like, you're driving on the highway and you see an accident and you come up on it and there's a person in a vehicle who's unconscious, and maybe the car's on fire or something and you need to get them to safety, and you pull them out of the vehicle, and in doing so you like break their arm or something. You are protected from like being sued for injuring that patient because you were acting to save their life. And so this is another situation where that Good Samaritan law can help you. Okay.
Okay.
Okay. Question 12. Based on Maslow's hierarchy of needs, physiological needs for a restrained patient include. So we're talking about physiological needs, and we're talking about a patient who's restrained, and it's a select all that apply. Private toileting, oral hydration, checking the tightness of the restraints, therapeutic communication, maintaining a patent airway. Which of
I'm
these are required? Go ahead.
I'll go with A, B, and D.
Perfect. Yes, all of those things are physiological needs of the patient. So that's great that you eliminated therapeutic communication because that's not a physiological need. The rest are, and we've talked about all of them, right? When we put a patient in restraints, we're responsible for their safety. We do check range of motion. We do make sure that their restraints aren't so tight it's hurting them. Obviously, we always want to maintain a patent airway for our patient, and they do deserve to get drinks and food and go to the bathroom. So, very good. Okay. A nurse identified a nursing diagnosis of self-mutilation for a female diagnosed with borderline personality disorder. The patient has multiple self-inflicted cuts on her forearm and inner thighs. What is the most important patient outcome for this nursing diagnosis? Remember, the nursing diagnosis here is self-mutilation. So what is going to be our outcome? Identify triggers to self-mutilation, refrain from self-harm, describe strategies to increase socialization, or describe two strategies to increase self-care.
Um, it could either be A or B.
Very good. You're right. It can be either one of those. So let's look at the question again. We know that the patient has self-inflicted cuts already. Um, and we obviously want to keep them safe, but we want to make a nursing diagnosis, an outcome for the nursing diagnosis of self-mutilation that is attainable, and that we can address in a short amount of time. So I agree with you that A or B would work in this situation. However, one of them we would focus a little more on, since we may not be able to do the other, if that makes sense.
um, I would say you would want to identify the triggers so that you would
Yeah.
know how to prevent it from happening.
Yes, that's, I think, the best way to look at this one, because you're absolutely right. A and B are both good outcomes. But in order for us to help this person refrain from self-harm, we should identify those triggers, because then the patient becomes aware of the triggers and we can help the patient avoid said triggers. Then we'll have them refrain from self-harm. Very good. Okay. The patient expresses sadness at being all alone with no one to share my life with. Which response by the nurse demonstrates the existence of a therapeutic relationship? Loneliness can be a very painful and difficult emotion. Let's talk and see if you and I have any interests in common. I use Facebook to find people who share my love of cooking. Loneliness is managed by getting involved with people. Which of these is an example of positive therapeutic communication, therefore denoting that there's an existence of a therapeutic relationship?
D.
Okay. So loneliness is managed by getting involved with people is kind of telling the patient what to do to fix it. Remember when we talk about therapeutic relationships and therapeutic communication, it's really important for us to be there for the patient and be empathetic and there were a lot of different characteristics that we talked about in lecture about therapeutic communication. But remember, some of them are like validation, being silent, things like that. So, with that being in the forefront now, do you think a different one would have been a better answer?
A.
Yes, definitely A. So, the key word here is therapeutic relationship. When you see therapeutic communication or therapeutic relationship, that should alert you that I'm looking for an answer choice that's going to be one of those characteristics we talked about. And the only one here that does that is A. They validate their feelings and they are empathetic with them. Remember, we don't want to tell the patient what to do. So C and D are out. And B could be um, like overstepping a boundary, right? We want a therapeutic communicate or a therapeutic relationship, but we want it to be professional. So saying something like, let's see if we have any interests in common is basically implying, well, I can solve your loneliness by being your friend. And we definitely don't want to do that, right?
Mhm.
Okay.
I need to use the restroom real quick.
Yeah, absolutely. Go ahead. So I'm going to keep going and we'll talk when you come back. Okay, next question. A male patient frequently inquires about the female student nurse's boyfriend's social activities and school experiences. Which is the best initial response by the student? The student requests assignment to a patient of the same gender as the student. She limits sharing personal information and stresses the patient-centered focus of the conversation. The student shares information to make the therapeutic relationship more equal. She explains that if he persists in focusing on her, she cannot work with him. So the question here is asking, it's a male patient who's always asking about a female student nurse's boyfriend. So you have a nursing student who is working with a male patient. And that male patient is constantly asking about her boyfriend, what she does for fun, what her school experience is like. So, asking a lot of questions about her personally. So, how should that student respond? So, of the answer choices here, limiting sharing personal information and stressing that the focus should be patient centered is the most therapeutic way to respond to this type of patient. Remember, when we are in clinical, we should not be sharing personal information about ourselves. So, answering questions about our significant other, telling a patient how our school is going, how we feel about it, what we do for fun, uh, what our hobbies are, those are all personal facts about ourselves that are not relevant to the student patient relationship. So we want to make sure that we avoid sharing personal information and then obviously redirect. We want to make sure that the conversation stays patient centered. Okay, next question. Which patient outcome is directly associated with the goals of a therapeutic nurse patient relationship? Patient will be respectful of other patients on the unit. Patient will identify suicidal feelings to staff whenever they occur. Patient will engage in at least one social interaction with the unit population daily. Patient will consume a daily diet to meet both nutritional and hydrational needs. So remember, this question is asking specifically about the nurse-patient relationship. There's only one answer choice that's related to that.
Um, C.
So A and C are about the patient interacting with their peers. D is about diet. So the only one that talks about staff and patient is B. Okay. Here we go again with therapeutic communication. It's the first two words. So, therapeutic communication is the foundation of a patient-centered interview. Which of the following techniques is not considered therapeutic? So, what we're looking for is the wrong answer. The other three are correct.
D.
That's right. Asking why questions. We've talked about that before as not really being therapeutic when it comes to a patient talking about their feelings or talking about their experience. Which nursing assessments are directed at monitoring a patient's fight or flight response? Select all that apply. So here we are looking for physical responses that we see in a patient whose sympathetic or fight or flight system has been activated. Blood pressure, heart rate, respiratory rate, abdominal pain, dilated pupils. So remember, with the fight or flight, our blood pressure is going to go up. Heart rate is going to go up. Our respiratory rate is going to go up. Our pupils are going to dilate so we can see better. The only thing that we, in these answer choices, that we don't really associate with fight or flight is abdominal pain. In fact, you may actually feel less pain when your sympathetic system is activated because you're in that fight or flight. The adrenaline is so high that you may not have the same sensory perception of pain. Okay, so A, B, C, and E are the correct answers. Okay, cognitive behavioral therapy is going well when a 12-year-old patient in therapy reports to the nurse practitioner, I was so mad I wanted to hit my mother. I thought that everyone at school hated me. That's not true. Most people like me, and I have a friend named Todd. I forgot that you told me to breathe when I become angry. I scream as loud as I can when the train goes by the house. Which of these is symbolic of what we're doing in CBT?
B.
B, very, very good. So remember, with CBT, we are thinking, we are addressing those distorted thoughts or incorrect beliefs that we might have and replacing them with more correct or um, better suited. So in this case, that's what's happening, right? I thought everyone hated me. Turns out they don't hate me. So that's that perception, that's distorted perception of people hating me. It's not true. In fact, I actually have a friend and most people like me. So very good. Which statement demonstrates a well-structured attempt at limit setting? Hitting me when you are angry is unacceptable. I expect you to behave yourself during dinner. Come here right now. Good boys don't bite. Which of these is a good attempt at limit setting?
A.
Good. A. Telling them that their behavior is unacceptable. Very good. Which characteristics suggest a man is experiencing the prodromal phase of schizophrenia? Select all that apply. Always afraid that others will steal his belongings. Displays unusual interest in numbers and specific topics. Has increasingly unusual thoughts and uses words oddly. Demonstrates increasing difficulty with concentration.
D.
You said D?
Mhm.
Remember, this is select all that apply. So just D or
I'm gonna say B and D.
okay. B is correct. D is correct. A and C are also correct. They're all correct. This is tricky because there's no all of the above. But remember, sometimes with select all that applies, it can be all of them, even though there's no option for select all that apply or for all the above. To provide effective care for the patient who's taking a second generation antipsychotic, the nurse should frequently assess for alcohol use disorder, MDD, stomach cancer, polydipsia, metabolic syndrome. This is second generation antipsychotics.
Um, A.
Not quite. So with first generation antipsychotics, we are mostly concerned with those EPS, right?
Mhm.
With second generation, we are more concerned with metabolic symptoms. So that's going to be like weight gain. They can develop um, sensitivities or insensitivities to sugar, so diabetes. Anything that we associate with metabolism would be a side effect with the second generation. So a patient who has those issues already might be better suited to a first gen, and um, those who aren't may be better suited for second gen. So remember, with first gen or the traditional antipsychotics, we're thinking EPS, and then with second gen, it's metabolic. A female patient diagnosed with schizophrenia has been prescribed a first generation antipsychotic. What information should the nurse provide to the patient regarding her signs and symptoms? Her memory problems will likely decrease. Depressive episodes should be less severe. She will probably enjoy social interactions. She should experience a reduction in hallucinations.
Um, D.
Very good. D. So remember, those first generations are really, really good for the positive symptoms of schizophrenia, hallucinations, delusions, whereas second gen, while they are still helpful for the positive symptoms, they're also very helpful for the negative symptoms, which are mood related. When patients diagnosed with schizophrenia suffer from anosognosia, I'm so bad at pronouncing that word, they often refuse medication, believing that the medication provided are ineffective, nurses are trying to control their minds, the medication will make them sick, or they are not actually ill. So the first thing is to remember what that word means. Do you remember what it means?
Um, it's when they don't believe that they have an illness.
Perfect. So which of the answer choices reflects that?
D.
That's right. The correct answer is D. The nurse is providing medication education to a patient who has been prescribed lithium to stabilize their mood. Which early signs and symptoms of toxicity should the nurse stress to the patient? Select all that apply. Increased attentiveness, getting up at night to urinate, improved vision, an upset stomach for no reason, shaky hands that make holding a cup difficult.
B, D, and E.
B and E are correct. B is not correct. Okay, 26. Substance use problems or disorders are often present in people diagnosed with bipolar disorder. Laura, a 28-year-old with a diagnosis of bipolar, drinks alcohol instead of taking her medications. The nurse caring for this patient recognizes that anxiety may be present, alcohol ingestion is a form of self medication, the patient is lacking a sufficient number of neurotransmitters, or the patient is using alcohol because she's depressed.
D.
Okay. Um, so in this situation, we are talking about medication and a patient not taking their medication. So while the patient is using alcohol because she is depressed, may be a choice you think of, we are we are assessing why she's not taking her medicine. So if it was that she's depressed, so she's drinking alcohol, well, why doesn't she just take her medication to help with her depression? So instead, B, that she's using alcohol as her medication would be more applicable in this situation.
Okay.
Does that make sense?
Yes, ma'am.
Okay. Because I totally get where you're coming from too. The patient's using alcohol because she's depressed. But also, that's an assumption that we're making too, because maybe she's not getting depressed. She's just manic. But definitely alcohol ingestion is a form of self-medication. It's important to remember with all disorders, not just bipolar. Okay, which response by a 15-year-old demonstrates a common symptom observed in patients diagnosed with MDD? I'm so restless, I can't seem to sit still. I spend most of my time studying. I have to get into a good college. I'm obsessed with counting telephone poles as I drive by them. I go to sleep around 11, but I'm always up by 3, and then I can't go back to sleep.
Um, D.
Very good. So A is more indicative of anxiety or akathisia. B and C may be more indicative of like an OCD. And then D, sleeping. That's one of the biggest disturbances with MDD, either sleeping too much or sleeping too little. So very good. That's the answer. The activity of gamma aminobutyric acid, or GABA, contributes to a slowing of neural activity. Which of the following drugs facilitate the action of GABA? So, which of the following drugs are going to contribute to, or do we use to slow neural activity? Benzodiazepines, antihistamines, anticonvulsants, or noradrenergics?
Benzos.
Benzos. So, with this question, you might think, okay, slowing neural activity, obviously we'd want an anticonvulsant too, right? Because we want them to not have a seizure, which is an increase in neural activity. What's important to note is that they specifically talk about GABA, and we know that benzos work on GABA. So that's where you would make that association. Good job. Okay, Isabel is a straight A student, yet she suffers from severe test anxiety and seeks medical attention. The nurse interviews Isabel and develops a plan of care. The nurse recognizes that effective teaching about mild anxiety when Isabel states the following. So we're talking about effective teaching. So it should be something that they're saying that's right. And furthermore, it's something that's right about mild anxiety. I would like to try a benzodiazepine for my anxiety. If I study harder, my anxiety level will go down. Mild anxiety is okay because it helps me to focus. I have fear that I will fail at college.
C.
Perfect. C. You are caring for Susanna, a 29-year-old who has been diagnosed with dissociative identity disorder. She was recently hospitalized after coming to the emergency department with deep cuts on her arms with no memory of how this occurred. The priority nursing intervention for Susanna is assist in recovering memories of abuse, maintain one-to-one observation, teach coping skills and stress management, refer for integrative therapy. Excuse me. She is presenting with deep cuts on her arms, and she doesn't even know how it happened.
Um, B.
B, very good. She's clearly not in control sometimes, which means that her safety is of utmost importance. And the only way for us to maintain that safety for someone who is not in control is to watch them at all times. Okay. The school nurse has been alerted to the fact that an 8-year-old boy routinely acts as a police officer, locking up other children on the playground to the point where the children get scared. The nurse recognizes that this behavior is most likely an indication of the need to dominate others, inventing traumatic events, a need to develop close relationships, or a potential symptom of traumatization.
D.
Very good. D. During a routine health screening, a grieving widow whose husband died 15 months ago reports emptiness, a loss of self, difficulty thinking of the future, and anger at her dead husband. The nurse suggests bereavement counseling. The widow is most likely suffering from major depression, normal grieving, adjustment disorder, or PTSD.
Normal grieving.
So, with the fact that she is empty, lost, having difficulty thinking about her future, angry, and the fact that the husband passed 15 months prior, we are no longer in the normal grieving window.
So would it be major depression?
I don't think that we have enough information for a diagnosis of major depression because remember, with major depression, we would need to be seeing these symptoms for 6 months or more, which in this case, we don't know how long she's been feeling these symptoms. And usually, if it is MDD, there would be a lot more than what she is telling us. And so we can also then get rid of PTSD. So it just leaves adjustment disorder. So remember, when a traumatic event happens or when something happens that changes the lifestyle of a patient or changes their environment, we can have an acute stress disorder that develops, which usually precedes PTSD. But when we're talking about 15 months after the event and they're still feeling empty and lost and they can't think about their future and they're still angry, now we're talking more about they're having difficulty adjusting to life without that person. So in that case, it would be adjustment disorder. Other thing to also note here is that we have a specific trigger, which is the loss of the husband. With MDD, there doesn't necessarily need to be a specific trigger. It could just be something that's been developing for a really long time with a patient. Does that make sense?
Mm-hmm.
Okay. I can see though with the symptoms that are listed, you would think MDD because those are all depressive type symptoms. But we have to remember that in this situation, there is a trigger that it's telling us about. So we want to focus on that. You are caring for Aaron, a 38-year-old patient diagnosed with somatic symptom disorder. When interacting with you, Aaron continues to focus on his severe headaches. In planning care for Aaron, which of the following interventions would be appropriate? Call for a family meeting with Aaron in attendance to confront Aaron regarding his diagnosis. Educate Aaron on alternative therapies to deal with pain. Improve reality testing by telling Aaron that you do not believe that the headaches are real. After a limited discussion of physical concerns, shift the focus to feelings and effective coping.
D.
Perfect. D. So remember, with somatic symptom disorder, they are physically feeling pain. So it's not appropriate for us to denounce that pain, tell them we don't believe them, confront them about it. Um, and while it is definitely an intervention to talk about ways to deal with the pain, this is asking for of these, like which would be the most appropriate at the time. And so D offers more than B does. We talk about their physical concerns, so we hear them out, we let them be heard, and then we shift the focus to, okay, these feelings we know are not going to go away for this patient. It's our job instead to help them understand their feelings and cope with them. So very good. Okay, safety measures are of concern in treating eating disorders. Patients with anorexia are supervised closely to monitor the following. Select all that apply. Foods that are eaten, attempts at self-induced vomiting, relationship with other patients, and weight.
A, B, and D.
Yes, very good. In evaluating an eating disorder, what physical criterion for hospital admission would you consider? A daytime heart rate of less than 50, an oral temperature of 100 or more, 90% of their ideal body weight, or a systolic blood pressure greater than 130.
B.
Okay. So B wouldn't necessarily be hospital admission because it could mean that they have an infection. We may just have to do a little more research to find out what's going on, treat the fever, treat the infection. When we talk about eating disorders, we're mostly concerned with their electrolyte balances and their physical well-being as far as things that could um, potentially be life-threatening. So the only thing in here that could potentially be life-threatening is their heart rate being so low. A lot of times people do have lower heart rates, lower resting heart rates because they're athletic and they exercise. But when we're talking about less than 50, we should be concerned, especially if we know that this patient has an eating disorder. Okay. Remember, hospital admission for eating disorders is going to happen if the patient is in immediate danger. So this 90% of ideal body weight, we're looking at that number to be like 75% or less. With the systolic blood pressure greater than 130, they probably aren't going to have high blood pressure. But if they do, it being over 130, maybe we need to look a little further. Maybe they need a blood pressure medicine. It's probably not related. Same thing with the temperature. So that just leaves the heartbeat. Okay. Do you have any questions so far?
No.
Okay. Probably going to stop there. I mean, we could probably do one more. Let's do one more and then we'll stop. Sleep deprivation is considered a safety issue that results in loss of life and property. Psychomotor impairments of sleep deprivation are similar to symptoms caused by sleeping in excess of 10 hours, misuse of caffeine, alcohol consumption, or working more than 40 hours a week.
Um,
So what we're talking about here is psychomotor impairment. Which of the following causes psychomotor impairment?
D.
Mm. When we think about psychomotor impairment and loss of life and damage to property, what substance is usually attributed to that?
Alcohol.
Yes. So the correct answer is C, alcohol consumption. Remember we talked about before that, well, me and you didn't talk about it, but in lecture, we talked about how the symptoms of sleep deprivation are closely related to that of being intoxicated in alcohol.
Okay.
Okay, so I will stop there. Um, if you have any specific questions about any content, I can answer them or help you with them. But for the most part, um, the HESI is going to be covering everything we've talked about, all the disorders, um, nursing implications, medications. So if during this review, any of the questions you weren't very comfortable with, I would go back and look at those topics. The other thing you can do, which is how this PowerPoint was made, is at the end of every chapter, there's practice questions in the textbook. Um, you can go through those questions, and if you're finding that you're struggling with some of them, then I would go more in depth into that chapter in key points. But if you're flying through those questions like no problem, then you can spend probably less time um, going over that chapter because you understand the concepts.
Is there any way you could send the PowerPoint to me?
I will make sure that's okay first. And
Okay.
if so, who's your instructor?
Professor Sarah Cox.
Oh, okay. Let me ask her if let me ask the author first if they're okay with it, then I will email it to Professor Cox and see if she wants to post it as an announcement. But if you don't hear anything, it's because they didn't want their PowerPoint shared. But I'll
Okay.
definitely ask. It's no problem.
Okay.
Cool. Or I could probably email it to you. But yeah, let me ask the author first, and if so, I'll email it to you.
Okay.
All right. If you don't have any other questions, this concludes the review.
Okay. Thank you so much.